as you're getting adjusted and we're getting your extension back, the first movement that you have to do every single day is this one. Going all the way to the back and then twice. And that creates a signal to the brain to let the body know that it still has that motion, so the brain doesn't have to slowly get rid of that motion over time. The second one is you can use a heavy foam roller, and once you can do a foam roller for 2 minutes over on the floor, then that's all that we need you to do to show that you have that full mobility after we're getting that mobility back for you. So you can use the foam roller, or I'll use something like this a lot, and basically you're on the floor and this goes over the spine and you basically let yourself kind of lean back. I either like to have my arms up so that it gets way back, or hands interlocked and relaxing, so eventually you can get your elbows down to the floor. And that's basically once a day for a minute or two is what you want to be able to do. The last extension exercise is the Cobra. And this is the only way that you can actually counteract all the sitting motions and all those 3,500 times we're talking about of going forward per day, is the Cobra. So your brain never wants to slowly get rid of that and give you arthritis in your low back. The biggest thing you can do is making sure to get that motion in. And it's doing just a good maybe 2 to 5 reps per day. Just like that. If you're having any pain or any trouble, then you would start super slowly and just start going up like this. Okay. Okay, that's the first one. You're seeing us regularly for treatment, and we're getting you that extension motion back in your upper back because you're going forward so many times per day. The other thing is the shoulders will get involved. So the more rounded your spine is, the more the shoulders want to come with it. And that puts a ton of the pressure on the muscles trying to pull your neck up. So that's why so many people get so much pain in here. So basically, the pecs pull you in this way. And then there's another big thing we're finding is that the lat and the subscap, it attaches here and it pulls you forward. So basically, if you can get through the door frame like this and just hold it for a good 5 seconds and then walk right through, that's what we want. It's called micro-mobility. We're finding it so much easier than if you do 20 minutes of mobility 3 times a week. Nobody ever gets to that. So if you can just pick a door or anything, a bathroom door, whatever, at home, and do it maybe a couple times in the morning, a couple times at night, 5 seconds, that's all we need to do. And we can do it right like that and open it up and then walk right through, so it doesn't take anything away from your day. The other way that we could do it too is a corner, where you get right deep inside into the corner like this, and you'll start to feel if one pec is tighter, but that's the whole goal, is to even it out. The second one for the lats and the subscaps that pull you forward is more of a stretch like this. I call it the prayer stretch. So you get your elbows down like this, feet wide, and I like to go really forward with it if I can, and then you kind of lean to the right a little bit and then lean to the left a little bit. So 30 seconds aside, 30 seconds in the middle, and trying to get your head down like that. The alternative is going and doing it on a chair. So again, and if you can't, because a lot of patients at first, their arms are really out. So if you need to, you can always grab some type of a stick and you would hold on to it so it prevents your arms from sliding way out. So you get your head, and the key is to get your head down and your upper back down and really stretch that out. And then you can kind of go to the right a little bit, and then you can kind of go to the left a little bit. But we find these are huge for getting the posture back and getting pressure off the upper back and the neck. Okay. The next big one we want to do is when it comes to the pelvis, and that's these two structures right here. We'll go into more detail in the explanation part of this, but these are the motions that go up. One goes up, one goes forward, the other one goes down and back. So usually it's something that happens over a long period of time, where those kind of get off, and your brain thinks that is the neutral. So it gets to a point where you have this motion and you're losing this motion. If you're walking, it's like your brain adapts very easily to this. So a lot of times there's no pain involved in any of this stuff. So the two major ones, as we get your pelvis equal and get that motion back so that it takes so much pressure off the lower back discs, and that's a big part of that cobra that we talked about earlier. Number one is making sure, and this muscle is so key for low back pain because it is probably 90% of the cause of a lot of it, because every time you're sitting at a desk job or just sitting at night watching TV, when you're eating dinner, these muscles are shortening. So basically I usually use the bed and hold on to it, or hold on to something that's a little bit stable. And you really want to get into this position. You want to pretend that you have a tail that's kind of sticking downwards. So you don't want to hold it like this, you want to stick it downwards. The other thing is a lot of people kind of bend forward with it. So you want to keep right up nice and straight. Try to pretend you're pushing your pelvis kind of where you're pushing your tail like a dog between the tail between the legs, and then we hold that. The last thing, if you can, is to slowly bend to the opposite side. So we can go this way too, and you'll get just more intense stretch that goes right up. And the key is doing both sides. So the next one would be this way. Same thing, you're upright, you're trying to push your pelvis kind of underneath, like your tail between your legs, and then holding that. If you basically want to make sure both sides are equal. The problem is if you have one side that is unequal because the pelvis is off. So if you want to make that just that little more difficult, you can just slowly shift, or basically shift right over like that. And you'll feel it right up the stomach a little bit more. Okay. The last thing that we really that we need you to get equal is I call it a lazy pigeon. So basically it gets to the point where we have to be able to have this motion. You don't ever want your hips and knees to break down over time, which they're really not supposed to break down at all. It's more of losing these motions that creates that. You want to sit right down on your bed or on a big coffee table, anything that's somewhat stable, I guess. And you could technically do this on the floor, but you just want this leg out of the way because it's a little bit different than the yoga pigeon. So I call it the lazy pigeon. You sit down on your sit bone. Basically, your chest and your stomach is equal to this leg, and you want to be able to go right down and hold. And the whole goal of this is to get each one equal, because based on how we will find and tell you how your pelvis has slowly gotten out of place, one will be harder than the other, and that's the whole reason that slowly the pelvis or the hip and the knee will break down basically. So it's getting to the other side and then making sure you sit down wherever that leg is at here. Make sure you can get kind of parallel to it, and same thing, you want to be able to go right down easy and equal. The people that have a problem over time are the ones that they can do the left side really well, but the right side, they'll be kind of almost pulled over like this, and they can barely get themselves upright. And that is the stretch, but the goal is to get upright so that you can do equally on both sides. It's such a huge thing in preventing hip and knee degeneration that people think is just normal aging. It's the loss of this motion that is the key to that. If you can't do this one right away, there's 3 ways to increase it. The first step is to go here. So a lot of people like to go this way, but you want to kind of twist and pull it up to you a little bit. Sometimes I'll even push my toes up to give me a little bit extra. Once you feel like that doesn't do too much for you, the second phase, you'd go on your back, just in bed at night if you want. You can pull the whole pelvis up like this and hold, or a lot of times I like to go right through and go here. But whatever you can do, that's the goal. Once you can do this with no problem, then you go right in to this one, and that's the goal, is once you can do this, then we know that the muscles can't slowly take you off after we keep trying to adjust you in the way that you need to be balanced again. So that third phase is going right down like that. So make sure they're equal. That's one of the most important things that we need to be doing as we're adjusting you. Okay. as we talked about in the information session of why we're doing these types of things, the big one is making sure that you never lose the ability. The toes are so important when it comes to breaking down the knees. So as you need to be able to get those toes pushed in as much as you can. So basically never lose that ability, especially the big toe and the other toes, to hit this huge flexion motion if you can. That's the one that you want to do. The other one is making sure you can get right down with it and sit right down into it like that, and you can make sure you get that nice full bend so that you have both perfect motion. Because over time, especially most men will lose this motion. And that is why over time, the more you lose that motion, the more it's going to affect the knees. So the other one is, it's doing a 2-minute sit on your heels. So basically, you want to sit on the ground. You might need a pillow for your knees if they hurt at all. But put the heels together, sit right down, put your weight down, and most likely you will feel the burning kind of through here. And the goal is to get to 2 minutes comfortably. So if you are feeling pain into here, that's a whole other thing that we'll talk about when you're in the clinic. But this is the motion that once you can do it, it shows you a pure full plantar flexion. Once you can do it for 2 minutes, that's the goal. That's all we need to accomplish, is being able to sit comfortably on your heels for 2 minutes with no problems at all. Okay. Last one is to make sure, especially for a lot of women that have worn high heels over long periods of time, and that's okay, but it's just the Achilles tendon can get short. So with all this toe motion, plantar flexion, dorsiflexion, this is the dorsiflexion. So it's a huge component of making sure the hips, the knees, the low back don't break down over time. So I find if you're a beginner, you have to just kind of go on the wall. It's the back leg that you want to stretch. You stretch it straight first and just make sure you can do that. And then the second phase is pushing the knee down. Once you're really, really good at that, then you can go up to the wall. You do have to have your shoes on for this for grip. So you want to get right up on the wall and push your knee into the wall. That's probably one of the best dorsiflexion Achilles stretches that you can do. Same thing, we want to make sure that you have both sides equal to each other. So once you can do this one easily for 30 seconds, then you'd want to straighten your leg and push your whole body up and do that for 30 seconds. Okay. So with a lot of the stuff that we've gone through today, and these are the little things to try to improve. Once you have them and then you can do them, like the heel sit for 2 minutes, then you don't have to do it every day. You just have to check it. Once you can do a full equal pigeon, you don't have to do it every day. You can just check it every couple weeks or whenever you want. But once you have that perfect motion, that's what our goal is, because it'll help us to keep you perfect. Once we get you in the right perfect alignment, that's what will keep it long term, so that you don't degenerate and break down your hips, knees, ankles, things like that. So the number one thing too is they're saying never ever lose the ability to do a seated squat. So we want to go right down. Sometimes in the beginning you'll have to go way out like that, but over time you do want to get right down, nice kind of straight up like this, and that shows that you do have the right mobility. It is just so bad to ever lose this type of a sitting squat. And it's just throwing it in your day, doing it maybe 30 seconds every day or a minute once a day. But once you can do this without any real problems, it's just such a huge thing for helping to keep you from breaking down over time. The people that can't do that, there's some studies out there and some research showing, like if you cannot do a sitting squat, or if you ever lose the ability to do a sitting squat, within 5 to 10 years, your gait cycle will be affected, and there's an 80% chance you will need some type of assistance to even start to walk. So that's why our bodies were meant to do that, by losing that lazy pigeon motion, and by losing the ability to do just a sitting squat. That's it. That equality is so important, and at no age can you ever lose this. If you can't do it, a lot of that other stuff will help you get to this, but the end goal is to make sure that you can get down and do a sitting squat comfortably and with ease, I guess, basically.